This podcast is brought to you by the Japan Regenerative Medicine Attend Center. So welcome to the first episode of a 10-part series. Today, in this deep dive, we're going to calmly unpack some recent news reports about fatal regenerative medicine accidents that happen strictly within Japan. Our mission here is really just to give you, the listener, a clear framework so you can evaluate your medical options with, total peace of mind.
Yeah, and I think it's completely natural to feel anxious when you see headlines reporting a fatal accident to regenerative medicine. But this is a massive, broad field. If we just react to the scary labels, we kind of miss the actual safety systems at play, right? So today is about looking past that panic to understand exactly what went wrong and why.
Exactly. And to do that, we have to look at the specific circumstances. So there was one case in August 2025 and another in March 2026. Both of these happened at private clinics strictly within Japan, and they both involved foreign patients receiving IV drips of autologous adipose-derived mesenchymal stem cells, which basically means stem cells harvested from their own fat tissue for chronic pain. When you look at it, the logistics are incredibly complex.
They really are. You're handling fragile, living biology across multi-location supply chains. And that August 2025 case really highlights the intense vulnerability of living cells. Investigations point to issues with the freeze-thaw process. I mean, if temperature controls fluctuate even slightly during transit, ice crystals can form and actually rupture the cell walls.
Wait, so instead of viable healing cells, you're essentially just injecting cellular debris?
Precisely. And when those dead cells are administered via an IV, they clump together. That debris is what likely blocked the fine blood vessels in the patient's lungs, which, causes a fatal embolism. The March 2026 case is still under investigation, but it involved a highly complex manufacturing system that was bouncing between domestic and overseas locations.
Wow. So the more those living cells move, the harder quality control becomes. Tracking that supply chain is basically a high-stakes game of telephone. But there's a whole other layer of risk, right? Because both patients were foreign nationals. That means critical medical histories and allergies had to cross a language barrier.
Which absolutely emphasizes the vital need for highly accurate medical interpreters. If you have a mistranslation regarding a patient's underlying condition, well, the safety of the entire procedure is compromised before the IV is even connected.
It's like a cascading risk. You're trying to keep fragile biology alive across borders while fighting language barriers. It makes you wonder, is that immense logistical burden what's driving the medical field's shift toward exosomes?
That is a huge part of the conversation right now, yes. Exosomes bypass some of those very specific vulnerabilities of living cells.
Okay, let's unpack this for a second. Just because exosomes aren't living cells, does that make them a foolproof, automatically safe alternative? Because, that sounds a little too good to be true.
And you'd be totally right to be skeptical. They are definitely not foolproof. Think of stem cells as like living replacement parts for your body.
Right, like the physical building materials.
Exactly. Exosomes, on the other hand, are more like the site supervisors handing out the repair instructions. They're just tiny messenger vesicles. And because they aren't alive, you don't have that same risk of dead cells clumping up and causing lung embolisms.
Okay, so the risk profile changes, but it definitely doesn't drop to zero.
Right, exactly. How those exosomes are manufactured and purified still demands rigorous quality control. It's not about finding a universally safe option. It depends entirely on a careful physician assessment of your specific condition.
That makes perfect sense.
Yeah, and this is exactly why I gently advise you against relying solely on slick marketing websites. If you are exploring these options and feeling overwhelmed, please utilize a proper consultation desk. Having a professional help you calmly compare medical providers and organize your thoughts is invaluable. You do not have to figure this out alone.
That is incredibly reassuring advice, and we're going to keep building your knowledge base. In our next episode, we'll dive into the specific differences between stem cell therapy, exosomes, and conditioned medium, so you can really understand what's in the vial.
I'm really looking forward to that one.
Me too. But before we go, just consider this one thing. As we shift from living stem cells to exosomes, which are essentially chemical instructions, we're moving from transplanting physical parts to hacking the body's communication network.
That is a fascinating way to look at it.
Right. If we can send repair signals today, what other instructions will we be able to send your cells tomorrow? It's just something to mull over before we meet again. This podcast was brought to you by the Japan Regenerative Medicine Attend Center.